Over the past few decades, the U.S. population has become increasingly diverse. This more diverse population means new challenges in the field of healthcare. Of significant concern are the health disparities that minorities face in this country, such as reduced access to healthcare resources or higher mortality rates for diseases or even pregnancy. It's the responsibility of healthcare providers to work to reduce these inequalities. One of the root causes of many of these inequalities is cultural bias. To combat cultural bias, healthcare providers have to work to develop a skill known as cultural competency. So what is cultural competency? In healthcare, being culturally competent means being able to communicate with and take care of patients from diverse backgrounds. A lack of cultural competency can lead to miscommunication, a lack of trust, or even outright discrimination, all of which hurt patient outcomes. It's important for all healthcare providers to be culturally competent, but it is often said that it's most important for nurses. This is because nurses spend the most time directly with patients. Cultural competency in nursing even has its own name: transcultural nursing. So how can we make sure our nurses are culturally competent? One of the simplest answers is to make sure nursing students are taught cultural competency. Today, we're going to be talking about transcultural nursing education and modern nursing programs. Transcultural nursing was not addressed in nursing education until the mid-1980s. Since then, two main approaches have been used. The first one is known as the categorical approach. This method teaches students a set of common values, beliefs, and behaviors for a culture. Many criticize this model for oversimplifying diverse groups of people. It's never realistic to think that an entire culture shares the same beliefs and behaviors. As stated by Dr. Susan Young and Christina Guo, there's often more variation among groups than across groups. Ignoring this inherent diversity within cultures as well as between them can lead nurses to stereotype their patients and actually cause more harm than good. This has led to a newer way to teach transcultural nursing, the framework method. This method is designed to help students develop a framework of skills that will help them deliver culturally competent care. Some of these skills include applying cultural knowledge across different contexts, or identifying your own biases and working to overcome them. Let's look at some of the ways transcultural nursing is taught. These classes can take on many different formats. They can be traditional classroom courses, clinical experiences, service learning, simulation labs, and more. Despite this variety, there are two broad categories that most programs fall into. The first consists mainly of in-class instruction and is more abstract. These classes tend to deal more with theory rather than practice. This form is also more likely to still contain aspects of the categorical approach. While obviously not applying to all programs, some of these classes can lead to the stereotyping issues we discussed before. The second category is experiential learning programs. These favor hands-on experience. They often include service activities and experience working with diverse populations. This style of teaching is much more effective in improving cultural competency. Research has shown that genuine interactions with diverse groups of people is the best way to improve your understanding and appreciation of other cultures. So, do these classes live up to their goals? Do they help students become culturally competent nurses? This is a hard question to answer. There isn't any agreed-upon way to measure a class's effectiveness. One common method is to assess students' transcultural self-efficacy. This term refers to how confident students are in their ability to give culturally competent care. The thinking is that more self-confidence will lead to better performance. Research shows that transcultural nursing classes do consistently increase transcultural self-efficacy. But just because students think they will perform better doesn't always mean they will. It's generally agreed that self-efficacy is an important part of being culturally competent, but is only one of many different factors that make up cultural competency and isn't necessarily the best way to measure it. The easiest way to definitively prove the effectiveness of transcultural nursing classes would be to show improvement in quality of care. Unfortunately, this has been a difficult task. So far, there isn't enough evidence to prove that transcultural nursing education improves patients' quality of care. There have been studies that show it improves cultural awareness, and we've seen it improves cultural self-efficacy. But when it comes to tangible behaviors, there are conflicting findings. There are a couple of reasons for this. One is that, like we mentioned, there isn't an agreed-upon way to measure cultural competency. There are several differing and sometimes outright conflicting opinions on how to evaluate it and its effect on patient care. This issue is worsened by the fact that many of the studies that do exist have quality issues like small sample sizes. Cultural competency is a difficult and somewhat abstract concept to measure. We'll need more quality research before we can prove the effectiveness of transcultural education on patient care. So while we can't definitively say for now that transcultural nursing classes lead to better care, they do still help nurses become more culturally aware and sensitive. A quick side note. There might not be enough evidence to say that cultural competency classes improve quality of care, but that's not to say that cultural competency itself doesn't. Nurses who are culturally competent do provide a higher quality of care. They communicate with patients more effectively, leading to less medical errors. They decrease health disparities caused by cultural bias, and they form better relationships with patients. These positive effects have been studied and established. The problem comes with proving what leads to these positive effects. So we've looked at which style of classes are more effective and how we can judge the effectiveness of a program as a whole. Let's ask another question. Is cultural competency something that can always be taught? We all hold biases, whether explicit or implicit. This is something we all have to work to overcome, and nurses especially. But for some people, these biases have become outright prejudice or even hatred. Unfortunately, nursing students are not immune to this either. People who hold these kind of prejudices can be especially challenging to teach to be culturally competent. And the question has been raised, can cultural competency always be taught? In 2017, a group of researchers completed a study on the effectiveness of a cultural competency class at the University of Wisconsin School of Nursing. In the results, they identified what they called amoral types. These were students who resisted learning the culturally accepting values taught in the course. They remained certain in their own beliefs and biases. This raises the question of how do you teach students who don't want to be culturally accepting? Or the more unsettling question, can you? This is just one example of an area that needs to be further studied. Transcultural nursing is still a growing and developing field. More research, funding, and interest is needed to help it reach its potential. But the research shows that transcultural education helps nursing students become more aware and sensitive to the cultures of others. There are still many challenges ahead and changes to be made, but our modern nursing programs are on the right track. They should continue to expand and improve transcultural nursing education in their programs. These efforts will help make our nurses more culturally competent, improving healthcare for everyone.